Welcome back. Thanks for joining in. We're going to continue a little bit more about the shoulder today. Last week we talked about how to reach overhead, whether it's in front of you or out to the side without lifting up that shoulder. Now I want to talk about how to reach. So how to reach forward without causing problems to the front of your shoulder or the top of the shoulder or even the back of your shoulder. I work with different athletes and different musicians who have to use their shoulder a lot, and so learning how to reach is a very important thing. So I'm going to turn sideways so that way you can see my shoulder blade. So when I reach forward, I want my shoulder blade to be able to come forward and generate the motion. So a lot of times if we are reaching, I'll see people kind of reach like this, and you don't see a lot of movement between my shoulder blade and rib cage. Instead, I'm moving forward, leading with my chest, and my arm goes for the ride, and I end up using my back muscles. So I tell people to imagine if you're at the edge of a swimming pool and a ball falls in the water. When you reach for that, you don't reach like this, otherwise you'll fall in. Instead, you reach, and if you're on the edge, you're going to reach and bring yourself back and allow your arm to go forward as you're reaching for the ball, because you want to keep most of your body weight back. That's the same thing I tell people with normal reaching, is we want our chest and sternum or breastbone to go in and our arm to go forward. Now I'll show you on this side, same thing, chest goes in, arm goes forward, and we're reaching from the shoulder blade. Now the other thing we have to watch out for is we don't want to lift up like this. So again, if you have tight upper trap muscles and you can't relax the shoulder down and feel it be able to be kind of spongy and down, you have to work on that first, because as soon as you reach, you're going to use these muscles instead of the ones, the serratus anterior underneath your shoulder blade. And I can feel that pop forward, but this muscle stays loose. And now the other thing is I want to consider, I'll show you on this arm, is as I'm doing that reaching, I have my hand here to make sure that I reach forward, but I'm not reaching with a tight pec muscle. I want that pec to soften so I can reach forward with my shoulder blade, and I can feel, it's almost like a stretch behind my shoulder blade, but it's really my serratus muscle kicking in while this softens. And so now I can reach and I'm clearing the shoulder joint so I don't get the impingement, and I don't get pain up on the top here, I don't get pain on the front, and I'm able to move freely without developing neck pain. I recently had a client who has a lot of neck pain, and this played a role in that as well. Every time she reached, it was with the neck and the pecs. So both the upper trap muscle was pulling on her neck, and then she had tight pecs, so she didn't know how to slide her shoulder blade forward as she was reaching. But as soon as we taught her how to do that, neck pain went away. I hope this helps, and we'll talk soon. Bye.